Good morning. My name is Erin Colburn, and I'm the Pre-Health Advising Coordinator for the College of Health Sciences here at Boise State University. It's with great pleasure that I introduce Rachel Holst from Idaho State University's Medical Lab Science program to share a little bit of information about the field, what makes Idaho State University special, and then answer some of our questions we have about the program. It's your turn, Rachel.
Thanks, Erin, and thank you for inviting me to be here. It's always awesome to be able to share our program with people, especially at different universities. And if you ever have any questions, Erin will have my email, and it's also on the PowerPoint, which I will share with Erin. But my email is hulsrach@isu.edu. That's hulsrach@isu.edu, and you're welcome to email me at any time with any questions that you have. So as we get going, I'm just going to, and if you have any questions as advisors or students, please, this can be as informal as it needs to be. If you need clarification on something, go ahead and stop me and ask a question. But I'm going to share a brief little PowerPoint here. Can you see that okay? All right, so med lab science. So hopefully at this point, since you're interested in med lab science, you know what we are. We are kind of a hidden profession in a lot of ways, meaning that a lot of people don't know what we are or what we do, but we're incredibly important as part of the healthcare team. We're a little less visible since we're back in the lab is, say, something like nursing, which tends to be more visible and upfront with patients, but we're every bit as important, and we have a great responsibility. We are the people that do the blood work and all of the body fluid work, and basically any tissue, blood, or body that can, or tissue, blood, or sample that can come out of the body is something that we are trained to test on. And we use those to determine the presence or absence of disease. We can use that to evaluate the effectiveness of treatment in things like cancer, for example, or just maintaining general health. Really 70 to 80% of the decisions that are being made by the primary care provider, whether that's the doctor or the DNP or whoever it is, they're really being based on what we're telling them back in the lab. The laboratory tests are very important. And so our job becomes very important. And it's a really incredible job where we are able to help patients, we're able to help save lives. It's incredibly rewarding. The only thing is people don't often know what we do, and we're often confused for phlebotomists. Phlebotomists are the people who are trained to draw blood, and while we are trained in phlebotomy, this is a much more advanced field that is a bachelor's and master's level program. So why choose the Med Lab Science program at ISU? Primarily because if you are in the state of Idaho, it is the only program, the only bachelor's and master's level program in the state of Idaho at this time. The national average salary starting is very comparable to other healthcare fields coming right out of graduation. You can see there the 2015 salary, and that's a little lower since it's a few years outdated now. We've been projected to grow 16% in the past decade, and we have seen that growth. It's been exacerbated by COVID, especially. COVID has we've added about 2 billion tests a year with COVID, and it has grown the departments in ways that we didn't project. So what that means for you as a student is that we have 100% placement. Consistently, we have 100% placement. And what that means is all of our students will have a job within a year of graduation. And quite frankly, I would say about 80% of my cohorts have job offers before they're even done with school while they're out in their clinical rotation. So that is good for you. There is I think we hear a lot in the news about like nursing staff, not staff shortages, what is it? The workplace shortage, meaning they don't have enough people to fill the jobs that are out there. We have that same kind of shortage in med lab science. We just don't hear about it as often. So what that means is you have jobs, and those jobs are all over the country. So if you want to stay in Idaho, that's wonderful. You can find a job here, but you can also take this degree, take your certification that you're eligible for at the end of the degree, and go and work wherever you need to work. The other thing is there's a lot of flexibility it's a really and what I mean by flexibility is, again, I kind of use nursing as an example because people are more familiar with that, but in nursing, you see like 7 on, 7 off shifts. You see morning shifts, you see graveyard shifts. You see PRN shift, which means part-time or as needed. So whatever your life situation is, you can typically find a job that will meet that life situation. I started, for example, on a 7-on 7-off shift before I was married and had kids, and I spent every other week traveling, and it was really cool. So there's a lot of fun things that you can do with this career in terms of the flexibility of it. Like I said, most will we'll get job offers before we finish our clinical rotations, and we definitely have above national averages on our pass rates on our national certification exam. So when you finish the program at ISU, the MLS program, it is nationally accredited. And that accreditation is required to earn eligibility for the national certification exam. And that certification is what allows you to walk into most hospital or clinical lab settings and get the job. So a lot of times, unfortunately, sometimes people get something like a microbiology degree, which is great, but unless they have the certification, they couldn't go up to St. Luke's or St. Al's and get that job in the microbiology department without that certification. They often want that certification, so that's really important. So as I mentioned before, this is both a bachelor's and master's level program. As I'm speaking to BSU students, you're obviously already working on a degree. So what I see with most of my BSU students is that they will graduate first at BSU with their biology or whatever degree that you're pursuing, and then they're working on their prerequisites while they're at BSU, and then they transfer over and they get their second degree at ISU. And if you go that route, it's a 3-semester program. It runs from August to August, and you don't have to go back and do any of your prereqs. You don't have to go back and do more gen eds. It's just the program. Once you've completed your prerequisites and are admitted to the program, it's 3 semesters, 16 credits fall, 16 credits spring, and then 6 credits of clinical rotations in the summer. So it goes August to August. And at the end of that 3 semesters, you get your second degree, which is a bachelor's in med lab science. And you also earn that certification eligibility that I was talking about. The other route for bachelor's is obviously you finish the prerequisites and you could transfer over. Like I said, most people at BSU tend to graduate first, but there is that transfer option as well. And then we also have a master's program. And the vast majority of masters would be, in your situation, would be route 2, which means you don't previously have the MLS certification. So you graduate, for example, with your bachelor's in biology at BSU, and you want to come over and do a master's, and you're welcome to do that on our route 2. And essentially you spend the first year doing the same coursework as the second bachelor's, but it's at the 5,000 level, and there's a little bit of extra requirements associated with the master level coursework. But the first year is essentially the same. At the end of your first year, you end up getting your certification eligibility, and most people will end up working their second year, and the second year is quite flexible. And that second year, you either work on you do some elective coursework and your thesis or capstone project. And we now have both of those routes approved. So thesis is more research oriented. Capstone is more like a senior project with a little bit more coursework associated with it. So I'm going to stop and breathe for half a second and see if there's any questions up until this point, or if I can answer or clarify anything. If not, I will keep going. All right, I'm gonna keep going. So the MLS curriculum, as I mentioned, this would either be the second bachelor's, or it would be the first year of the master's program, except all of these would be at a higher level if you were at the master's program. But as I mentioned, it's 16 credits in the fall, 16 credits in the spring. This should say 6, excuse me. That's 6 credits in the summer for your clinical rotations. So I just want to draw your attention to the kind of coursework that we do and the kind of stuff that you would be learning. So phlebotomy, as I mentioned, that's where we're going to learn how to do drawing of blood. Urinalysis and body fluids is really important. We look at cerebral spinal fluid, we look at urine, we're looking at kidney function, pregnancy testing, meningitis, all sorts of things associated with those fluids. Hematology and hemostasis is really cool. So hematology, that's your red blood cells, your white blood cells, your platelets. So we're talking about hemostasis is like clotting disorders. A lot of you are familiar with something called hemophilia. That's where somebody is missing a clotting factor and they can't stop bleeding. There's so much more involved in hemostasis, and we talk about all of those things. Hematology, we're looking at anemias and cancers and platelet disorders, and you'll actually be able to look at a slide and determine what kind of cancer somebody has. And that information is really important, or it's not, doesn't have to be cancer related. It could be anemia or a red blood cell disorder or something else. So you can see now the information that you're learning, how applicable that is for information that we can give the primary care provider to really help these patients. Medical microbiology, we're looking at viruses, bacteria, we're looking at fungus, viral, all these things. This is incredibly important. Like I said, in the age of COVID right now, that becomes incredibly important. But we do this all from a clinical perspective. Medical chemistry, don't get scared off by chemistry if you don't love chemistry. This is more organ function chemistry. Are your lungs working? Are your kidneys working? Is your liver working? What happens when those things start malfunctioning? What are we seeing in the lab? How do we test those things? Medical immunology, this is really important for ELISA testing, for point of care testing. And what I mean by that is things that you would do. Some other professions like nursing and pharmacy also do some immunology type testing. Pregnancy testing is a good example of that, but it's much more involved with that as well. Transfusion medicine, this is blood bank. This is somebody gets into a car accident, hopefully not anybody but they need blood. We're the ones who are matching and typing that. Getting a little bit more specialized, we're also the people who will match and type organs when they come in, if you are in an organ transplant hospital type setting. And then lab class is the hands-on stuff that we do. And then in the spring class, we carry on with that. We do advanced coursework. We get into molecular techniques, and we keep going with your education and management and prepping you for your certification exam. And then you take that information out in the summer and you go and it's 6 credits, but it works out to 12 weeks of clinical rotation time where you'll actually be an intern in these clinical settings and you'll get to do hands-on stuff. And this is where, like I said, most of our students will get their job offers, is why they're already in their practicums. And we will place you, we're responsible for placing you in those clinical rotations. And we have affiliations with pretty much every lab in the state of Idaho and many labs out of the state of Idaho. If you have interest in working in other states, we have affiliations with a lot of different states. And we can, if you, for example, you didn't want to stay in Idaho and you're like, hey, I really want to work in Oregon, for example, or Utah or somewhere else, and then we can try to get you in a lab down there and hopefully you can get a job offer there while you're doing your rotations. So we really do try to get you where you want to go in terms of clinical rotations. We are limited, of course, based on the availability of who those people will take at that time. But that is the curriculum in a nutshell. Like I mentioned, at the end of those 3 semesters, you'll earn your bachelor's and your certification eligibility. If you're a master's student, this is your first year. You'll earn your eligibility at that first year, and then you'll go on and take an additional 16 credits your second year. And that includes some electives and your thesis or capstone work. So that's the curriculum. And I just want to mention with the curriculum as well, you can see how closely aligned this curriculum is with a lot of professional school curriculums. And why I mention that is this is an excellent degree to use as a stepping stone if you wanted to go into a professional degree like PA school or med school down the road, because the curriculums are so well aligned with what you'll learn, and you'll have such a deeper understanding of the lab part of your job that you would be dealing with down the road. So just throwing that out as well as an option of using it as a stepping stone, or you can build a great career as an MLS as well. So prerequisites, we mentioned prerequisites. I purposely left off the prefixes because they tend to change, but any of your advisors, Erin, can work with you on prefix to make sure you're getting the right classes. But college algebra, statistics, biology is a prereq to get into some of the other prereqs like cell biology, AMP, genetics, immunology, and pathophys. And then we require 16 credits of chemistry, and Gen Chem 1 and 2 must be part of that 16 credits with their associated labs. One question I get a lot from students, like they come in with calculus instead of algebra. If you have a higher math from 1143, you do not have to go back and take 1143. If you're taking like 1160, that would substitute for that. Also, sometimes people take biostatistics instead of statistics. That's also something that would work for that statistics criteria.
Rachel?
Yes.
Is microbiology still a requirement?
Yes, it should be on here. Thank you. Microbiology.
We
Thank you.
do offer microbiology as a 200 level course. It's our biology 205. I think it's like 221 at Idaho State University, and you have accepted that in the past.
Yeah.
I
don't
think
know.
that's
It's
the
not
number
formatting,
one
but
big
it's there.
question we have from a lot of students. And correct me if I'm wrong, but if students opt to take organic chemistry and or biochemistry, there's some kind of extra bonus points for
Yes.
on the application.
So one problem that we had was students were taking 11, 12. You have the same numbers at your university, right? 11, 11, 11, 12. So they were going back and taking like 11.1 and 11.02 because they didn't want to get up and take the OChem and the biochem. So we give extra points on the application for people who have 3,000 level chemistry or above.
Right. So our three, basically our organic chemistry at the 300 upper level, and biochemistry can support students in being a more competitive candidate if they choose that, but you do accept our chemistry 101 and 102.
Correct. And sometimes people get forced into that just based on semester offerings and the timing of their schedules, and that's fine. And the other thing I would say about chemistry is sometimes biochemistry particularly is under a bio prefix instead of a chem prefix. It will still count towards those chemistry credits if it's under a biology prefix.
Perfect. And ours is under a chemistry, so that works out really nice.
Perfect.
Question, immunology. That one's a hard one for our students to get only because it's offered only in the fall. Offer immunology in the summer still?
We do. Every summer we've been offering an immunology class. It's a 6-week online class, so it's really convenient. So, and we tend to offer it every summer right before the program starts. So the thing I will say, prerequisites do not have to be done to apply. They just have to be done before you start the program. So if you were to apply right now, for example, and you were missing immunology, your admissions letter would just state you're admitted pending that you pass this class before you start the program. And then you would have to send me your finalized transcripts when that was done, or just unofficial transcripts so I can confirm that. And you would have to pass that class before starting. So we do offer it. So admissions, for example, I'm in the middle of admissions letters will go out April 1st. And then I have at least 14 students who are taking our summer immunology class this summer who are planning to start the program in fall. So we're planning on continuing to do that because there's been a great need for that immunology in the summer. And it is an online class, so it's pretty accessible.
Yeah, the instructor that teaches it, they're teaching other things during other terms. And so
I get that.
They've been able to pull it off in the fall. Okay.
Yeah, and it's the same thing at our university. So we've seen that need for immunology in the summer, so we'll continue to offer that.
Great.
And we're planning on it this summer as well. We do caution that we only like to have MLS students in that immunology class. But if they're planning on going to med school or whatever, I would try to get that fall biology class if they can, rather than our summer online. But if they can't, then that's great.
Okay. Well, they would be the only ones I would probably recommend because they're the ones that are trying to get it and be in the application cycle. So, okay.
So we've been talking about how to apply. Because of the way the curriculum is built back here, you can see we have classes in the fall and then advanced classes in the spring and then rotations in the summer. So students can't come in the spring or the summer, and that should intuitively make sense. So we only admit for every fall semester. We have a new cohort every fall, new cohort. That didn't come out correctly. And the application deadline for that is February 28th. And that is for priority consideration. Now, let's say you have a really good candidate who comes to you right now, the second week of March. If I have space in that cohort, I will still accept it. There is a place on the ranking system, and I can show you that system too, how they get ranked, where they get their points for the application. They just don't get the points for being an on-time applicant or a priority consideration applicant. So I will still take late applications, but there's no assurance that they would get in, but I will still look at them, especially if I have space on a campus for them. So just because I have that deadline doesn't mean it's a hard, fast deadline. They can still try to get their application in, but earlier is better, obviously. So there is 2 parts to the application. There's an online application. It's just a Google form. It's right on the website, right under I'll show you. Maybe I'll go to the website in just a second and show you, but there's a link. It's just a Google form. It just basically gives, here's your information. Here's my campus preference, because we do have campus at Meridian, which is up there in Boise, Idaho Falls, and Pocatello. And so you can pick your campus preference as a student on that online application. And it also gives you a chance to outline, this is where I finish my prerequisite, or this is my plan to finish prerequisites before fall. And that's all it is. It's just a Google Doc. That's what we call the online application. And then there's a packet that you send in, has a personal letter of interest. This is 1 to 2 pages, why you want to do the program, why you think you're a good fit, any information that doesn't come across elsewhere, like work experience, or, you know, hey, I had a bad semester and this is why. Anything that you want me to know that doesn't come across elsewhere in the application, you can put in that personal statement. 3 recommendation letters. There's a hyperlink on my website for a document that they can fill out, or they can write a letter. I don't need both. But the form that I have on the website tends to be easier for people to fill out, and you just print it off. I ask that you get those back in signed sealed envelopes, but if your person giving you a recommendation is not comfortable doing that, they can mail it directly to me. And then you put that in your packet, those signed sealed envelopes, and then unofficial transcripts. And I'm going to say unofficial, unofficial, unofficial 3 times, because no matter what I say, people always tend to send me officials, even, and you're paying for something you don't need to. Because I will caution that the MLS application is separate from ISU admission. So you get admitted to, you can do your application to MLS first, get admitted, and then apply to ISU. And then when you apply to ISU, they're going to need official transcripts. And I don't want you to have to pay for those twice. The only reason I look at that is to check for prerequisites. So when you apply to ISU, you'll send the officials. To me, in this packet, I only need unofficials. And I've said it 4 times now, and somebody will still send me officials. So please don't pay for those on the MLS application. Any questions on that?
Maybe I didn't see it before, but what's the average GPA?
I didn't put it, but the average GPA tends to be, for the Boise campus, about 3.4. 3.3 to 3.4 is a pretty average GPA. So, you know, and that's saying half or above, half or below, right?
Mm-hmm.
So I've had the whole range. Our minimum GPA is 2.5.
Mm-hmm.
And I've had the entire range almost every year. So we are competitive, but that being said, it's not the same kind of competition that you're going to look at like at nursing school. We're not getting 400 applications a year. We're going to get between 80 and 100 a year, or, you know, 60 to 80, depending on the year. So we're turning away far fewer students. And so the higher your GPA, the GPA is the highest indicator for admissions. It has the most points on our ranking scale. So keeping your GPA up is important. But if you have a 2.5 GPA, we don't want to discourage you from applying, because we found homes for many students, and those GPA ranges have gone out and become certified professionals that are really enjoying their career. So that is something to know for advising somebody who is like, hey, I really want to get into nursing, or I really want to be in healthcare. I'm more familiar with nursing, for example, but hey, this might be a better route for me for several reasons. So also, it's a really interesting route for people who, I don't want to use the word introverted, because introverted isn't the right word, because I'm not an introvert and I love the lab. There's a lot of people who are not introverted that are in the lab, but people who really want to make a difference and be involved in healthcare, but don't necessarily want to be so upfront with patients. This is also a really great career for that too.
Do they need, so, you know, like with our pre-med students, stuff like that, there's other things that they do need, you know, gaining experiences and stuff like that. Is that the same for MLS, or?
No, they'll get more points. Sorry, I didn't mean to interrupt you.
Oh, you're good.
They'll get more points on their application if they do have experience. The vast majority will come in and not have that experience, because it's really, really hard. Labs with HIPAA and the space and everything, they don't typically have people shadowing and kind of doing that volunteer kind of work. So they typically don't have people with experience in lab coming in. So that is not something that is required for our program.
Okay, awesome. Great.
And like I mentioned, we do have students at all 3 campuses. These numbers are a little bit flex. We have to cap it around 50, because that's the number of students that we can place out in clinical sites in those rotations every summer. But between campuses, these numbers could shift a little bit. Like if we needed 22 in Meridian, we could take 18 in Pocatello, if that makes sense, if we had really 2, you know, outstanding students. So this is kind of where we shoot for in terms, but it really can be in flux a little bit. It's mostly just we cap it out at 50 every year. And you, like I said, in the online app part of the application, you can make your preference, or you can say, hey, I don't have a preference. But if you do have a preference, go ahead and put it, because if for some reason a campus should fill up and you were wanting that campus and didn't get in, I would then email and you say, hey, would you consider Pocatello or Idaho Falls instead? So if you want to be in Meridian, put Meridian, don't put any campus unless you really don't care which campus you're going to. And then I mentioned a little bit before the career path. I specifically mentioned using it as a springboard for like PA school or med school, but there's a whole number of different things that med lab scientists can do with their career. You can go into government agencies. We've heard a lot about the CDC in the last few years. People are more familiar with those government type health agencies. There's public health, hospitals. So we can work, you've seen those classes, those classes we take now. You could work in any one of those departments: hematology, blood bank, molecular. You could specialize into any one of those departments, or you could be a generalist. And a generalist is somebody who works in all of those areas and kind of floats through them. I worked a lot as a generalist, and I really liked keeping my hands on a little bit of everything. I also worked in molecular oncology at a reference lab down in Utah. So if you get bored in this job, it's your own fault. Every day is different, and you can basically specialize. You can do whatever shifts you want. You can do whatever area you want, depending on the openings at that lab. And if it's not something you want to do originally, you might start as a generalist and then move into a specialist in one of these departments. The sky's the limit there. And then you can also work up into supervisory and lab director positions. But if you have ambitions to do that, I would suggest doing the master's program instead of doing the second bachelor's. The second bachelor's is really great if you want to get out and get working, get certified quickly, and start paying off your student loans. That's really big for students, is wanting to just get out and get a job quickly. And that's 1 year from the time you start, you could be out doing that. You could go on and do advanced education, like I mentioned. You can go to education like I did. I'm now at ISU teaching in the program. There's industry jobs, there's healthcare administration jobs, consulting jobs, there's just so many things that you can do with it. You don't necessarily have to stay in the lab for the rest of your career. I have one of the guys that I graduated with. He got hired by an oil company because of his lab background and technique. He got hired by an oil company, and he does the quality assurance, quality control for this oil company, and he makes a ton of money. I don't know what exactly company he's working for, but he was hired because of his certification and his expertise in the lab. So there's a lot of different things that you can do with this career. Or like I said, you can build a really excellent career just staying in the lab, if that's your interest and love and passion. So why do I love this career? Huge demand. I can take this job anywhere. I've lived in several states and had a job everywhere I went. There's huge flexibility in terms of the shifts that you want. Some people really want to be at home when their kids are little, for example. This is a job that you can pick up and put aside if needed. If you didn't work for 2 years, you could come back in 2 years and still have a job. And they would still hire you as long as you're maintaining your certification, which just requires 36 hours every 3 years of continuing education. And they're really, really easy to pick up. Maintaining your certification is really quite easy. It's never redundant. There's so many opportunities. I talked about transplant medicine. I didn't even talk about forensics, but forensics likes to hire out of our program. Most of the people working in the forensics lab in Utah are graduates of our program. That one tends to be popular with students. They like forensics, but there's not as many job openings. So you have to be around for a job opening when that opens if you are interested in forensics. We're also saving lives. And like I said, it's a great stepping stone. So that's why I love the career. That is my contact information here. If you need to get a hold of me, like I mentioned, my email is hulsrech@isu.edu. That's my phone number. I will get back to emails before I get back to phone, just so you know. And then our website. And I'm going to take you to the website really fast. Let me stop sharing this just so I can show you the admission stuff. Okay, let me share my screen here. Here we go. Can you see that okay?
Yeah.
So this is our main website. It's really easy, isu.edu/MLS, and it'll take you here. When you're talking about admissions, you just go to this admissions button, drop down and hit apply. And this will give you all the information of the graduation, how to apply for the program. This is the rank system here that I was telling you about. This is how students will be ranked in terms of points. We look at your overall GPA and then your prerequisite coursework GPA. This is what we were talking about earlier. If you have 3,000 level chemistry or above, you'll get those extra points. If you have clinical lab experience, you will get extra points as well. Like I said, most people will not come in with this, so it doesn't tend to work against you if you do not have that, so don't let that discourage you. But definitely let me know if you have other type of laboratory experience, like you're on an NEBRI grant, for example, or you did research with somebody in your undergrad. Those are all things that you would want to let me know in your letter of intent so that I can get you those other 5 points. And then if other work, I can award 2.5. Recommendation letters, I'll show you the link for that in a second. Most people will get 10 out of 10 out of this because they're not going to send me a recommendation from somebody who's not going to recommend them usually. Communication, this is about your letter of intent. Is it clear? Is it free of grammar problems? Then the application deadline, like I said, they'll get 5 points on their application if it's in before the end of February. These are the points that you would not get if you were a late applicant that I was mentioning earlier. Reapplicant is rare. This is for somebody who, for some reason, like dropped out because they had a health issue or something. We generally don't have reapplicants. And then sponsorship doesn't apply to you. These are for our online students only who are out in rural sites who are not able to make it to a campus. So that is the ranking system. Any questions on that? Okay. And that's all listed on the website. This is the online application that I was telling you about. This is just that Google Doc that lets you fill out your preference, your campus preference, how you're going to fit. This is where you put in your GPA and stuff. It's really easy. It'll take about 5 minutes. And then it gives information. This is supposed to be your packet. This is where you mail that packet. And everything for the master students is the exact same, except that packet is turned in through the graduate school application instead of being mailed to me. So I have both of those routes listed here on the website for bachelor's and master's applicants. And then you can see here, I also have a hyperlink to that recommendation form. It's really easy to fill out for people who are asking somebody to give them an evaluation. Like I said, this is all that I need for a letter. They don't have to actually write a letter with this. There's space at the end that they can let me know anything else they want me to know. Some people send it with a letter. That is not required. They're certainly able to, but not required at all. So I need either this or a letter. Who sends the letter of recommendation? That is typically, as long as they're there's no hard fast rule, but they should be professional references. So they can be a faculty, they can be a lab instructor, they can be a boss. It's going to be a red flag if I start getting them from mom or roommates, right? So as long as you're having professional references, there's no hard fast rule. I usually tend to tell people 2 faculty, 1 boss, or research or something along that line is kind of what I like to see. But like I said, there's no hard fast rule. And that is it in turn. And all this, like I said, is on the website. My contact information is there as well. Really easy to find. So, and the faculty, just to introduce us, like I said, I'm the program director. Marge is our primary instructor up in Boise. She's really great. Ryan's down here, and we travel between all 3 campuses, and I have a number of lab instructors. So Ryan, Marge, and I are the main show for now. But that is all I have prepared. So if you have any other questions or if I can answer anything.
What's the worst thing about being a lab technologist?
The worst thing? Lack of recognition. People not knowing who we are. I'll tell people I'm a med lab scientist, and people just look at me like, oh, okay. And then explaining to people what you do and then forgetting about 5 seconds later. It's just not a very commonly understood profession or transparent profession.
Okay.
But like I said, it's so rewarding and I love it. So
what's the best?
Flexibility, the demand, meaning we're needed, and just it's so not boring. I mean, I haven't been bored a day in my life since I started this career. I go, there's that really silly old saying that if you love what you do, you don't work a day in your life. And I really feel like that because every day it's just something different and exciting. And, unfortunately, some of the coolest things we see in the lab are the worst for the patients, but we get to see that whole, especially if you're a generalist, you could be doing, looking at cancer one day or liver dysfunction or kidney failure. So it's just so interesting.
Okay.
I don't know if that answered your question.
You did great. What advice could you give to students who are interested in looking and pursuing something in the medical lab science arena?
If you have somebody that that's med lab scientist, talk to them, ask them what they think, and also just get in touch with me early, because if they're talk with your advisors, talk with me, so that there's no surprises when it comes time to apply, so that you're ready to go. I mean, the earlier you talk to me, the earlier you talk to Aaron or the other advisors, the better off you're going to be, because like I said, you're going to want to plan your schedule, your student schedule, to be able to start in a fall. And I would hate for a student to miss a cohort because they're only missing one class, for example. So early planning, keep your GPA up, and talk to people who are in the profession, because that's where you're going to get, is this really a right fit for my interests? And if you don't know somebody in the profession, you can talk to me about it, and I can tell you my perspective, or give you some past students that you can talk to, or whoever, or maybe even some people on the bench at the hospital right now.
See, there you went with just segueing right into my next question. What advice can you give to students about gaining some experience?
So experience is more difficult with the lab. Like I mentioned, there's not a lot of labs that will let people come and do like volunteer work in the lab. However, people can get experience with, either doing early research with if you have interest in researching who I work with, one of your biology professors or something, and do research with them early, or you could get into phlebotomy early. There are several short phlebotomy training, and you could actually work as a phlebotomist before you start the program. And that would give you an advantage, because not only would you be essentially done with that class, but it also gives you a perspective of part of the lab proceedings, because pre-analytical in the lab is huge, and phlebotomy is definitely part of that pre-analytical, and the things that can go wrong, and the ordering and specimen processing, all those things would give you an advantage. So if you have interest, time, and availability, like I said, none of that is required, but if you wanted experience before coming in, those would be two good routes to pursue.
So I'd like to add also, just as a shameless plug, tomorrow night between 5:30 and 7 is the Idaho State University Health Science Night. And there will be individuals, representatives from the medical lab science program there at the Meridian campus. It's been one of my favorite things to go to. And what's really cool is you can see the anatomy lab there, but you can also see the microscopes, and they often will put things like malaria on there, and you can be like, wow, I didn't even know that's what it looks like under a microscope. It's pretty cool. So I encourage that. And then also, we've been working with St. Alphonsus. So St. Alphonsus, their medical lab group, they're looking for someone that they could train on the basics. And then also they would help maybe support and pay for an education through Idaho State University's program. So we would encourage you to think about looking at those assistants and those smaller bites if you're thinking about that. And I have some contact information for those folks that they've reached out to us and said, hey, we're looking for somebody just to kind of get their whistle wet. And then if they really are passionate about it, they can then get that further training through Idaho State University. So those are my little pitches that go with that. Shannon or Britta, do either of you have any questions? I don't want to capitalize on the time.
Actually, I did. So you said that you have students that come into the MLS program and they're using it as a springboard for pre-med or something else. How often do you see that, and what's that path like for the students?
I generally see. Sorry, my son's awake now. I generally see 2 or 3 a year. And then within 5 years, I will have several more that have spent a couple years on the bench, and they're like, okay, that was great. Now I want to do a little bit more or something different. So within every cohort, I would say maybe about 5 will use it to go on to a different profession, like PA school or med school. And as long as they're working on the prerequisites for that program, a lot of times they'll have those done before they start the program, or they'll work on them after or concurrently. It's really hard to do anything concurrently with the program because the curriculum, 16 credits is a lot. It's an intense curriculum for a year, but the experience of the lab and then working in the lab, and that gives you clinical hours or patient exposure hours or however you want to do it. For example, like PA school really needs those patient exposure hours, right? And so lab is one way to obtain that, especially if you're doing the phlebotomy side of things. So we've had really a lot of success getting our students into these programs. And we've even had students get into dental school. PA and med school tend to be the most common. I've even had students go on to healthcare administration. So they have a lot of success, and they really stand out in terms of applicants because they're not one of 5,000 biology degrees anymore. So I think I've had the students who have applied, I think I've had 100% success getting them into those programs.
What's the, so I know you mentioned something about introverts earlier.
Mhm.
Not everyone that does MLS is an introvert, but so what does the average student look like, and what kind of demographics are there?
Across the board. So we actually have, this is one of the, I'm sorry, I don't know. Across the board, we tend to have more females. Actually, this is one of the more female dominated science arenas, but we do have a fair number of males. So you're going to see that. We also tend to have a lot of international students who come in and like the program. We have a large number of Nepalese students, Middle Eastern students. So there's a lot of diversity, at least diversity that we would see in Idaho, right? All age ranges. I've had people in my last cohort, I had people who worked for 50 years and have decided to do a career shift. And so I have a lot of, I would say the average age is actually like 22 to 26, which tends to be a little bit older demographic, not only because it's your senior year or second bachelor's, but sometimes people come back and want to do it later. So we have the whole range of, 20-year-olds to 50-year-olds. We have men and female, we have all genders. We have all, I don't think there's a specific fit. I mean, if this is what you want to do, you are going to fit in, if that makes sense. That's what I'm trying to say. It's not like you're going to feel like a fish out of water if you're in the profession.
Right. So there's not like the imposter syndrome necessarily.
Right.
Awesome. That's cool.
So with international students, it can get a little trickier because once they go out to work, they have to be sponsored, and not every hospital will sponsor, but we try to get them associated with those hospitals and labs that will sponsor them if they have intentions of staying in the country. Did that answer your question?
Yeah, it did. Thank you.
Anything else? Any other questions?
I almost made it through the whole lecture this year without kid interruption.
Welcome to our world, right?